take their seats. We're going to be starting the task force hearing in just a few minutes.
Are you going to charge me extra for?
Boss. I love it.
Well, good morning, ladies and gentlemen. If I could ask everyone to take their seats, we're going to begin the hearing. Okay, you can put me hot. Well, good morning. I'd like to first welcome you to the 3rd Senate District and to the St. John's University, the former Bourne Estate. I'm very proud to have a lot of my colleagues in government and in the communities here, as well as individuals who are on the front lines of this battle, this epidemic, heroin and opioid abuse in our communities in New York. I'm going to make some introductions. First, a little protocol. For those who are testifying today, we're going to ask you to come up to the microphone. And because we do have a lengthy list of individuals from the community who have taken their time to come out and to talk to us about their experiences and to share it with the members of the task force and their voices in government in Albany, just please take the allotted time and allow for your friends and neighbors to also have the opportunity to talk to the members up here. So I have to make some introductions, and I'm very proud to say that so many of the Senate majority have come out because this is important in all of our communities. The 3rd Senate District is unique, as is every Senate District, but the one thing that we have all found in talking with each other is that the problems in our communities that are caused by the heroin and opioid epidemic are all the same. We tell each other stories about what's going on in our communities and some of the people that we've lost in this battle, and the stories sound eerily similar. And that is why we're here, because this product that was started by Senator Phil Boyle when this task force, the first chairman of the task force, began, and what Assemblyman Al Graff and the Assembly have done, and others, has really shaped policy in Albany. So I'd like to introduce to you the co-chairs of the State Senate's Heroin Task Force, and that is first Senator George Amador, who could not be with us today, but Senator Rob Ort from Buffalo, Senator Terrence Murphy, Senator and Dr. Terrence Murphy, excuse me, Senator Phil Boyle, I referenced, Senator Tom O'Mara, who's come to us from the Binghamton area, Senator Jack Martins, and Senator Michael Venditto. And Senator Ken Laval will be here shortly. We're also joined by our colleagues in the Assembly, and I do have to compliment Assemblyman Graff, Assemblyman Garbarino, Assemblyman Saladino, who are all here today. Assemblyman Graff, as you know, is a former law enforcement, so he has seen this on the front lines as well. I'd like to also introduce the members, and they'll be coming in and out today, individuals who will be testifying, my colleagues in government, Councilman John Cochran Jr., the County Executive Steve Ballone will be joining us today, the Suffolk County Commissioner of Police Timothy Sinney, Councilwoman Mary Kate Mullins, Councilman Michael Agurcio, who's joined us today from Brookhaven Town, Suffolk County Police Investigator Michael Caldarelli, Mayor Morris Sperry from Mastic Beach, the Ronkonkoma Civic Association President Bruce Edwards has joined us today. Thank you, Bruce. Mary Calamia, who's a licensed clinical social worker. Steve Chasman, the president of the Long Island Council on Alcoholism and Drug Dependence. Reverend Michael Stanek. Tony DeFelice from Catholic Charities. John Coppola, the New York Association of Alcoholism and Substance Abuse Providers. Father Frank Pizzarelli from Hope House. Dr. Jeff Reynolds, President CEO of Family and Children's Associations. Simon Zisman, Employee Assistance Resource Network. John Javis, Advanced Health Network. Nick Van Breda from Washington Heights Corner Project. Superintendent Butera. Great South Bay Coalition representatives, Dorothy Johnson. Town of Islip Youth Enrichment Services, we have representatives here today. Max Stout, I mentioned, I'm sorry, that's Dottie, and the Blue Star Moms. And I've probably missed other community leaders or people who have come today to hear what's going on. I approach it this way. If I were to ask everybody in the audience if there are any cancer survivors, I guarantee there would be a bunch of people who would stand up with their head held high, their chins up, and say, yes, I survived cancer. Alcoholism and addiction is a respectable and treatable disease. It's a function of the brain. It's a function of our physiology. People who are in the throes of addiction do things that are bad. But they're good people who do things that are bad because they're in the throes of addiction. They're not bad people. This is a disease of hope, in my opinion. Unlike cancer in so many ways, this is something where the power that throws somebody into addiction in the human brain, that same human brain has the power to heal. And people can and do recover from this and live very long, healthy, happy lives one day at a time. There are a lot of resources in this room. There are a lot of networks in this room. And part of this hearing today is not just to educate these legislators in this task force who go all over the state, by the way, and have done this. How many times, Senator Ward? 7 times for you, Senator Murphy? So this is something that's going on. It's not just to educate them about how we should shape policy to help primary prevention education, law enforcement, more enforcement on the street to go after the drug dealers, and treatment, rehabilitation, and recovery. It's not just that, but it's to get the networks and the resources that we already have in the community, all of you, together, so you know that there are resources to help. With that, I'd just like to introduce my colleagues, the co-chairs of the task force, to give any opening remarks that they have, and then I'll open it up to the other panelists for brief opening remarks. So, Senator Murphy, Dr. Murphy.
Senator Croce, thank you for allowing me to be here today in Suffolk County. I am from Westchester County and just came down this morning and had a lovely ride over the Triborough Bridge, and we made it here safely. But it is a true honor and a privilege to be here. I represent the 40th Senate District, which is Westchester County, Putnam County, and Dutchess County, and I am one of the co-chairs along with Senator Ort and Senator Amador. And like Senator Croce has said, we have literally traveled New York State. We were up in Senator O'Mara's district not too long ago, and the theme is the same everywhere we go. It is happening to really, really good families. It has no race. It has no religion. It has no ethnicity. It will shake down really, really good families. We have got to take the stigma off of this heroin problem. I had the privilege of this past summer of representing New York State and going down to New Orleans for a pain management and heroin opioid problem. And, you know, we're not alone. I'll tell you that right now. New York State is not alone, and we've learned some really good stuff. We're doing some really great stuff. Being able to travel New York State and listening to the people and listening to the issues gives us a sense of what we need to do in order to combat this epidemic, because it starts, I believe a lot of it has started, and the number one issue has been the overprescription of Oxycontin, oxycodone, and the Percocet and the prescription drugs. So we're here today to listen, and if there's anything that we can do, we most certainly will be here to help in any way, shape, or form. But I would just like to thank Senator Croce for allowing us to be down here and being a staunch advocate of protecting the community and helping us with this. So, in all due, sir, I appreciate the privilege of being here today.
Thank you, Senator. And the other co-chair who's joined us today, who's come, I think, the furthest, although there might be a tie with Tom, distance further, from Buffalo, and that's Senator Rob Ort.
Is it on? Is it on? All right. See, in Buffalo, we don't even have microphones. We just go live. So, well, I want to thank everyone for being here. First of all, I want to thank my colleagues. I want to thank Senator Croce and Senator Boyle and all my colleagues up here, and, of course, my co-chair here, Senator Murphy. As he mentioned, we have done, many of my colleagues, Senator Murphy and I, Senator Amador, but a lot of the colleagues up here have attended multiple hearings across the state, everywhere from very rural communities to, here to Long Island, up in my district, Niagara, the city of Rochester. And as Senator Murphy pointed out, the one thing that you realize very quickly, even though you are in very different communities and you have a lot of different socioeconomic factors at play, there are certain themes that have transcended all of those factors. And I think that's one of the reasons why when you hear about the heroin epidemic in the presidential race, that's a sign that this is a real issue across the country. It's not just in New York State. It's not just in one pocket. It's across the country. We're losing young people at a very rapid clip. There were 23 deaths in a matter of weeks in Erie County, which is right next to my district up in western New York. 23 deaths. When there was remember the Ebola scare, when that was going on, there was, I think, maybe a couple across the entire country, tragic as that is. But I just think it sort of highlights the stigma that Senator Murphy talked about, that there's 23 deaths in one community, and yet it doesn't seem to quite get the focus, the attention, the media coverage, what have you, that maybe is warranted. I can tell you that the Senate and my colleagues up here are certainly not in line with that thinking. We have done a lot of work to try and bring light and focus to this epidemic and try to bring solutions, because it's not just about having a hearing. The point of these hearings is to listen to what we hear from people on the front lines, providers, parents, law enforcement personnel, and take that back and come up with meaningful legislation, meaningful reforms. It's not just enough to come here and do the hearings, and it isn't just enough to spend money. Certainly resources are important, but it's where those resources are appropriated that's going to make a big difference. In the recent budget, the adopted budget, there was $166 million for drug rehabilitation, heroin-focused rehabilitation services, but most importantly, $25 million new money. So that's $25 million in new funds specifically for heroin and heroin treatment services. Now, I'm not going to tell you that that's enough, because I think we would all agree it's probably not. However, $25 million in new funding wouldn't have happened were it not for the people up on this stage, and even more importantly, people like yourselves all across the state who have come forward and helped us better understand what we need to do to try to tackle this epidemic and really ultimately to try to save lives. I met a mother in the back when I first got here who lost her son a couple years ago. And now she's on a mission, and she's trying to take something very tragic that I don't think anyone could ever explain, losing a child, and turn it into something positive. And I meet mothers and parents like that every hearing that I go to. There is a parent who stands up, who lost their loved one, who lost a son, who lost a daughter, and it's heartbreaking. and we don't have simple answers for those people. But I guess the bottom line is we're here. I believe we're going to have some real great legislation coming out later in this session. We've put the resources and some new funding in place. And the bottom line is we are listening to you, and together, community by community and collectively as a state, we can save lives and we can stem and push back and roll back this terrible epidemic. So thank you for having me here. Looking forward to the testimony, and thank you for coming out.
Thank you, Senator Ort. Senator Boyle.
Thank you, Senator Croce, and thank you for holding this forum today. I'd like to thank my Senate colleagues, particularly the co-chairs, Senator Murphy and Senator Ort. This heroin epidemic, as you know from our original task force, we started almost 2 years ago now. We held 18 hearings around the state, and were able to pass 11 pieces of legislation into law in record time, about 10 weeks. That's almost unheard of in legislative parlance. But up here today it shows that the epidemic is a microcosm of what we're seeing. We have Rob Ort all the way from Niagara Falls, Senator O'Mara from the Southern Tier, Senator Murphy from Mid-Hudson Valley, all around the state. This is not a Long Island or a Staten Island or a New York City problem. It's a statewide problem, and we have to have statewide answers. And we are very fortunate here on Long Island, and I see the list of people who are going to testify, to have not just the strongest advocates and people that have committed their lives to ending this epidemic, but also the foremost experts on opioid and heroin addiction in the entire state and maybe the country. And you'll hear from them. What we're looking for, as Senator Ort said, is information about the legislation we passed. Is it working? Does it need to be modified? How can we make it better? How can we make your efforts more effective and efficient? And also any new ideas. It seems like every day, unfortunately, we're reading a story about some other new aspect of this epidemic. I think it was today in Newsday, fire chief in North Babylon administered Narcan, and the addict woke up and beat him up and gave him a concussion. Something you really don't think about. And as a former EMT, I know the old expression, they wake up swinging. They're upset that you did away with their high, but really we need to figure out a way to protect the first responders, but also not have them say, no, I don't want to administer Narcan. I don't want to get beat up by an addict. This is an issue we need to address and make sure that people know they can safely administer Narcan to get the person back on their feet and get them the treatment they need, but also protecting themselves. And again, thank you for today, your testimony, and thank you, Senator Croce.
Thank you, Senator Boyle. Next, colleague from Nassau County and a little bit of Suffolk. That's Senator Mike Venditto.
Senator Croce, thank you. Thank you, of course, to everybody for attending today, this very important event. To my Senate colleagues, Senator Murphy, we're going to try and get you here a little quicker next time, put you on the Throgs Neck Bridge maybe, and see how that goes. And, of course, to my colleagues in the Assembly as well and the local media, who's also here sharing the testimony and what we're going to hear today. You know, state and local government exists for any reason, folks. It's to ensure that we protect our residents and bring them health, safety, and welfare to the greatest degree that we possibly can. That's why, of all the issues that we will discuss here and throughout the length and breadth of the state, nothing is more important than what we will talk about and what we will hear today. I heard reference made before to the stigma that I believe had existed for quite some time when we were thinking about and talking about addiction. I have to give a lot of credit to the communities who we represent, to the residents who we represent, because throughout the course of the last couple decades in particular, people have been lifting that stigma. You know, families have been sharing their stories. Law enforcement officials have been talking about their experiences. We've had many gatherings like this where we have gone over the dangers and the triumphs affiliated with addiction. You know, I'm a new state senator, as are a few of my colleagues on the dais. It's my second year on the job with the state. It's also my second year on the job as a father, a first-time parent. And what I'm finding in my travels is that you can't get them early enough. You know, my son and I don't necessarily communicate in full sentences yet, but I've already started planting the seeds. I really have, to talk to him about the dangers and what to stay away from. And you just can't get to them early enough. We have to ensure that we educate, particularly our young people, about the dangers, what they're doing to their bodies, what they're doing to their minds. I think about the successes we've had with cigarette smoke. You know, a generation ago, a lot more people were taking up cigarette smoke, but because we have continuously put that message out there about how bad it is, we've had a lot of success. And I think there's reason for hope that we can do so when it comes to addiction. Our role, I think, among many other things, is to make sure that you have the resources you need to get the job done. So to the extent that we can funnel down the finances, the information, whatever it may be, we want to be here to help make that happen. As we know, and it's been characterized this way so many times by so many different people, it's a war, isn't it? A war against addiction. But you continue to gather together like this, one day at a time, keep chipping away. You win battle after battle after battle, and eventually you do win that war. Your presence here is going to help us get there. We thank you for being here today. We look forward to the testimony to come. Thank you, Senator Croce.
Thank you, Senator Venditto. Senator O'Mara.
Thank you, Senator Croce, for having me down to the island. It's a pleasure to be here. Had a great night last night with you and Senators Boyle and Ort. Thank you all for coming out here and being participants in this today. You know, this is going to take everybody at all levels to deal with. We just can't fix it at the state, no matter how much money we might be able to throw at it. And it's never going to be enough money. But let me tell you, I come from the Elmira Corning area, southern tier of New York, Finger Lakes region, right on the Pennsylvania border, a little over 5 hours from here. Senator Ort, it's another 2 hours plus past there to get home. So, you know, we spread across the state with the representatives that we have here today. And while I come from a largely rural and somewhat some small cities, but quite small cities, the rural impacts of this heroin epidemic are every bit as severe as they are in our suburban and urban areas. And it makes no difference whether you're rich or poor. The impacts are great. You know, I have 3 children, 3 teenagers, and I am scared to death of this epidemic because I've seen at these forums the stories that we hear from the great families that these young addicts come from and get involved, that this epidemic knows no socioeconomic restrictions whatsoever, and it's something we're dealing with in our agricultural farming communities as we are in our suburban and urban areas as well. You know, I'm a former assistant district attorney where I worked in Manhattan for several years at our law school, and I was a district attorney of Chemung County, where Elmira is the county seat. And I can tell you that this is not an issue we're going to deal with by arresting, prosecuting, and jailing our way out of this. We're way beyond that in this fight on addiction. It's not a criminal aspect. While I have supported and we have passed some strengthening of laws, particularly for those that are dealing and preying upon the addictions of citizens, we have to do a lot more in regards to the prevention and hopefully keeping people from trying it in the first place. But most importantly at this point, the lack of resources that we have in treatment capabilities with detoxification centers. You know, to get treatment in my area of the state, some of my constituents would have to go 2 hours for a detox or an inpatient rehab facility. It's totally and woefully inadequate for the problems that we have. And while we are increasing funding in a significant way at the state budget this year to total funding of $166 million, you know, that's not going to create still enough beds for the treatment that we have and the needs that we have in our state, in all corners of our state. So it's going to take everybody. As I said, the state just can't do it on their own. So those of you that are here from the community groups, from churches, it's going to take everybody working together in a variety of ways because as we all know too well, when that bell goes off with the addict and they want some help, you got to give it to them then and there. You can't say you've got to wait 30 days to find a bed somewhere. You can't say you got to wait 72 hours to find a bed somewhere. And we've heard countless stories at the forums we've had. We just recently had one in Penn Yan in Yates County in 2014 when Senator Boyle was the chair of this task force. We had one in Elmira and one in Auburn in the Finger Lakes region as well. And I've heard too many stories of my son or daughter was going to go into treatment in a day or two and overdosed and died and never made it there. We can't afford to have those kinds of delays in this system. Once that opportunity is there to be able to get with that individual as soon as possible when they're ready to make that change. But we also need to do a lot more work in prevention and work in our schools to keep kids off of this in the first place. But Senator Croce and the whole task force, thank you all very much for having me here.
Thank you, Senator. Thank you, Senator. Senator Martins.
Thank you. Well, good afternoon, everyone, and I want to thank my colleagues for being here and for hosting this event. In particular, I want to thank Senator Croce for hosting. I want to thank Senators Murphy and Ort for their continued efforts as chairs of this task force. I come from just up the road in Nassau County. The Long Island Expressway, otherwise known as the Heroin Highway, connects us, Nassau and Suffolk County. And not to reiterate some of the points that have already been made by my colleagues, I want to highlight some of the positive things that have happened as a result of this task force over the last couple of years. We've passed laws, bills that have been signed into law that require education for children at an elementary school level that allow for us to begin bending this curve back, because it has to start with education. 2, we've passed legislation that has allowed and required insurance companies to cover inpatient treatment without having a person fail at outpatient treatment before getting the needed treatment, because it just simply didn't make sense, and we were able to do it through the efforts of hearing from communities through forums like this. We've started the effort of destigmatization of drug abuse, which is so critically important as we go through our communities, and I can share stories, we all have them, of communities of mine in my district that I got calls from parents telling me, well, you certainly don't mean blank, you fill in the blank, because we don't have those issues in our community. And the reality is we have it in every community. We have offered and provided resources for first responders, whether it's Narcan training or other training that they need, so that when they do arrive at the scene, they are able to administer, not only evaluate, but administer emergency care immediately. All of that happened through the efforts of my colleagues who are sitting here on this dais and those who have served on this task force and heard testimony from communities throughout the state. But there remains a real question that we all have to ask ourselves as we go forward. If this were a natural disaster, when Sandy hit the South Shore of Long Island and hit New York City, we marshaled every resource under the sun, and we made sure we got help to where it was needed. We spent billions of dollars, and money was no object. And what we have here before us is no less severe. What we have here before us is an epidemic that is taking hundreds of lives every year, where thousands are overdosing every year. And we're still talking about steps that we can take. And so I'm looking forward to the testimony today, but I would much rather see us find a cure for this issue, because we know what it is. We'll spend billions of dollars finding a cure for cancer, billions of dollars getting to the root of Alzheimer's and early onset of dementia. Autism. There's a cure for this. The cure for this is education. The cure for this is putting resources behind inpatient treatment. The cure for this is making sure that we get people the care that they need. So we know what the cure is. We just have to find the resources to do it. And through forums like this, we will continue to work towards that end. So again, I want to thank my colleagues for this opportunity, and I want to thank everyone who will be testifying here today for the opportunity to share with you our common experiences so we can go out there and tackle this once and for all. Thanks again.
Thank you, Senator. I know we have a list of people who have come to testify, and we appreciate that. I just want to, again, remind you that we're going to be limited in time. Any testimony that you would like to submit in writing, please do so. If it's beyond what the timing allows when you get up to speak. Remember that this is being videotaped. So many of us who have attended 12-step meetings in their lives, open meetings, and understand the process know that there are cameras here. So just remember that for anybody who's getting up to tell any personal anecdotes about their experiences. But do share whatever you feel comfortable sharing. And also, I'm going to take some people out of order for no specific reason other than some people who have come to speak to us today have to leave or they have other commitments, so we want to try to be considerate of that as well.